take around 40 minutes to finish this closing up. And first of all, I'd like to thank you very much for contributing to the science, to the ideas, but also opinions that have been brought to this Tanzania Summit 2025. Can we have a round of applause to ourselves? Today we are going to have presentations from what have been done in terms of the key deliberations, as well as the data in terms of our participation, the level of participations, and the growth of this summit. Before further ado, I would like to welcome Dr. Jeremy, board member of Tanzania Summit, to come in front and have his words, as well as inviting Arnold Kaihula, who is the General Manager for Tanzania Summit, to give a presentation.
Thank you so much. You are clapping for me or for him? This is for him. I'm waiting for me now. You are good. And in another country, we say you are gooder. So you are gooder. I think this is the first time you will see the president of the Tanzania Health Summit being the MC. That is the change of the new era, isn't it? So we really appreciate having somebody who is really humble and want to involve everyone. So I would like, on behalf of the board member, to be part of presenting the deliberation of this Tanzania Health Summit. That will be done through presentation, but also few announcements and word. But before that, I would like to recognize and appreciate the presence of representative from the Ministry of Health, representative from the Pure Raj, representative from the UN agency. We have WHO, UNICEF, UNFPA, other UN agency, minister directors. I would like to not name people, a lot of implementing partner, and of course, board of directors, distinguished guests, I will say all protocol observed, and ladies and gentlemen. We are so happy, and I think the time is flying so fast, like we are starting the summit. Like it was yesterday or this morning, and we are soon to close. Should we extend the number of days? No, yes, no. But 3 days is good. Let's be consistent. So Arnold, who is the general manager of the Tanzania Health Summit, will be presenting the Tanzania Summit summary in numbers, but also some takeaway note. After that, I will have few comments. Arnold and the technical team, you are welcome.
Hello. Hello. It's very difficult to speak after your boss, but I would like to take this opportunity to thank you all. Our numbers are amazing, and as we close the 12th Tanzania Summit, I would like to take you through how many people we had and who we had for our 12th Tanzania Summit. We have gathered over 1,702 delegates. And these are from 25 nations and representing over 362 organizations. We had over 11 ambassadors represented, 350 CEOs and directors of different organizations. So these include from the public, private, and non-governmental organizations. We had 25 ministerial executives and 120 regional medical officers and district medical officers. And again, a good number of district officers at different levels attended the conference. We had 54% of male and 46% of female. I hope the number has not changed much from the previous conference, but I hope as we proceed forward, as we're going forward, at some moment the numbers might change because there is an incremental participation of women and young people in the conference. And one of the indicators that the summit will be sustainable, who will be the delegate for the next 50 years, are the young people that we have and have engaged in the discussion that we had. People, over 35% of the total delegates were young people. That means under 35 years old. Science, knowledge, and exchange. We had 2 plenary sessions, 1 CEO roundtable, 1 youth capacity building workshop, 38 forums covering different aspects of healthcare systems, and 200 abstract presentations from various researchers. Over 45 exhibitions, 57 exhibitions from different organizations had an opportunity to showcase their innovations and their products. Among them, 35% were international organizations, and we had 75 sponsors and partners, and please clap hand for them. Thank you so much for your continued support and for collaboration and partnership. Media and visibility. It's very important that we do not discuss ourselves, but our story reached the millions. We had 35 media houses, the journalists, covering the whole aspects of the contents for different forums and sessions that were proceeding. We have digital coverage with estimation of 9 million people reached with our trending hashtag of THS 2025. Awards. If you do good, you must be acknowledged. We had Cheer Innovation Award, specifically recognizing the young innovators in healthcare system. But we have Nturi Primary Healthcare Awards with 3 subcategories. We had 9 categories for Healthcare Workers Award of the Year. We will be submitting the Best Abstracts Award to 4 best researchers today evening. We have submitted the certificates and trophies for different partners and participating institutions that have extended their support to support Tanzania Summit. Thank you so much. Let's get prepared for THS 2026. Before I leave the stage, I'm told I'm supposed to take you through the key takeaways. As we well know, we had very hot discussions over the past 3 days. The rooms were hot. Our theme centering on harnessing data utilization and the technologies to accelerate universal coverage. The rooms were hot. if you can count the number of ideas, innovations, thought-provoking ideas that has been emerged throughout 3 days, it's amazing. So, digital transformation for better health was one of the key emerging, and from all over the discussion that we had for the past 3 days. And we have seen the necessity to scale up digital innovation through such as electronic health records and AI, telemedicine, and mobile platforms. As we well know, we are going into digital revolution. So health sector is very important to be transformed through digital health systems and to increase our coverage through health systems. But we have seen data as a driver for universal health coverage, helping decision makers to make decisions from the primary health care to the ministerial level and to the global level. Data and harnessing data collection, data utilization, and data consumption is very key. And partners and stakeholders throughout the conversation have highlighted the necessity for that. Another issue that arises throughout the conversation was on sustainable and innovative healthcare financing. As we well know, the healthcare financing landscape is changing at very rapid pace that probably if nothing else is done, we can be left out. So we have seen that it's a right time and there is a very important need to increase domestic resource mobilization, especially for healthcare financing. If we can finance other sectors, why not health sector being on donor dependence? But also we have seen inclusive community-centered health solutions, especially for the digital solutions. We need to go back on the board to design with the communities for them and to make the better solution that they really need. But also we have seen strategic investment in public health priorities, especially in vaccination, neonatal, maternity care, family planning, and screening delivery. Very important, as we expect that this will bring the return on investment if we're well invested, including the use of technology to advance those issues. Governance and efficiency. No matter how much we mobilize, but if you cannot spend effectively and with good governance, efficiency, and accountability across all levels, from our conversation of the first day throughout the third day, CEO round the table, the stakeholders have shown why we need governance, efficiency, and accountability to improve the structures, transparency, and accountability across all levels. Patient-centered and collaborative care model has been one of the another raising theme throughout the discussion, shifting towards value-based healthcare that prioritizes patient outcomes and holding accountability on every investment that we make at all levels. Thank you so much once again. Clap hand for yourself as you stand up until the last final. Clap hand for yourself, please. Thank you, thank you. Thank you, all partners. Thank you, the board members. Thank you, everyone. God bless you. See you, THS 2026. Asanteni sana.
Arnold is now becoming a politician. He's saying, thank you, God bless you. Okay, that is good. I just want to make a few comments regarding this Tanzania Health Summit. As you can notice, it is continuing to grow in terms of number, right? So, but also in a very difficult context. Do we have more donors coming to support? No. Do we have more sponsors coming to support? No. But we have been able to help this Tanzania Health Summit. So this is a very big achievement, sign of resilience, and it's a good reason to clap for ourselves. There are some numbers that was not given to you. It's about financing. Financing the Tanzania Health Summit is not an easy thing. It's a very difficult task. And if we have been able to have the Tanzania Health Summit this year, it is because of you. It is because of your participation. It is because of your commitment. So what I would like as a takeaway for you is next year, don't come alone. Come with somebody with you. Do we agree? You should not come alone. You have to come with somebody else. You have to find a sponsor for the Tanzania Health Summit so we can continue to work, you can continue to deliver. Because as I'm talking to you, it's not about, it's not for profit, it's for non-profit. And I have to tell you, the place where we are living, in this center, the price is going up, while the contributions are going down. So next year, sponsors, rather than double what you are giving to the Tanzania Health Summit now, please don't even ask them, double. Close your eyes and double. Those who are registering, double. If they ask you $1, give $3, that will be good. And this is the way God will really bless you, okay? Yeah. So this is really a call for you to support the Tanzania Health Summit to be sustainable, because without funding, it will be difficult. Unless you agree we can make it somewhere else where there is no AC, there is no whatever, and we will, but I don't think you would like to be in this kind of condition. So with that, I am going to move to a next role, that is an announcement. You saw that it is an organizing committee every time doing the job, and we are here to enjoy. One of the board members, I will say, Dr. Chaku, who is the chair of the board. At the same time, he is the chair of the organizing committee, and he has been chair of the organizing committee for 12 years. So it wasn't an easy task. So this year, he requested if we can have a kind of transition. He's still the chair of the board, but it's good to have a transition for someone else to support being the chair of the organizing committee. And together, the board member agreed to ask someone from the board, who is Dr. Samuel Ogilo, to now take over the role of the chairperson of the organizing committee. So please stand up and please come here. So for those who don't know him, here is his bio, short bio for you. But we are sharing because he may be coming to you for your collaboration, for your support, and we really want your support. So the past or the former chair of the state organizing committee will remain supporting him for 1 year before moving completely out. So to symbolize it, please, President of the Tanzania Health Summit, can you come? Oh, don't, okay, yeah, okay. President, come. So we need to have a witness of transfer of responsibility, power, and everything. So as a witness in front of all of us and in presence of the rest of the board member, I would like to request Dr. Chaku to hand over symbolically the new responsibility to the new chair of the organizing committee. Under your clap, please. So, Dr. Ogilo, do you have few words to say about your, please, come and say a few words, and people will thank you again for what you did, and don't move away with all your sacred trips. Promise.
Good afternoon. First and foremost, I promise I'm not moving away with my sacred tips. But second, I would like to thank you everyone, and to thank you, Dr. Ogilo, and the board members for this very enormous good decision for the summit. Once again, thank you everyone. Welcome, Dr. Ogilo.
Thank you, Dr. Chaku, who has done a great job. 12 years is not easy. The first time I had the idea of the summit, he came to my office with the president, and we had somehow a hot discussion for about 2 hours. It was early morning meeting, talking about the Tanzania Health Summit being started. And from that day, we have formed a very strong bond. Started with a lot of hard work, and have seen him steer Tanzania Health Summit through very difficult times. And therefore, getting into his shoes is not easy. But I'm happy that we have the president here, and him still the chairman of the board. The work will be easy with their experience on board. Otherwise, I thank them and thank every one of you, and I expect to get good collaboration from everyone. The way you did it with Dr. Shaku, I believe you'll even do it more. Thank you very much.
Well, thank you so much. For those who want to give a check or envelope, you can see them later. It is already open. So, few announcements before I hand over to the Master of Ceremony. So, you may wonder when will be the next Tanzania Health Summit. We agree as a board member that the next Tanzania Health Summit 2026 will be held from October 7 to 9. Where? Who can guess where? Where? I can't hear you. Where? You are right. Dar es Salaam. Dar es Salaam. No, this one, I love you. You know how to guess. You all say Dar es Salaam. It will be in Dar es Salaam. Good. So the next Tanzania Health Summit 2026 will be from October 7 to 9 in Dar es Salaam. Book your calendar. Don't find an excuse to not be here. If you are doing a wedding, postpone for next after the. Okay? So. Okay, the next one is what? This is a word I learned in Tanzania, vote of thanks. We vote to thank you, we thank to vote you. So, I really want to, on behalf of the board member of the summit, to thank you all for your trust, commitment, dedication to support. And this has been key to maintain and to continue progressing the Tanzania Health Summit. That I will say is becoming a leading summit in Africa. Check. You will not see something like this. I also want to use this opportunity to give a special thanks to the government of Tanzania, who from the top leadership has been always here, present, to support us. This also goes to the government of Zanzibar, and you saw it last year, the support they provided to us. Please clap for the government of Tanzania. We also know that the success of this Tanzania summit relying on time, people time to organize it, contact, connect, and make everything ready for us. I'm referring to the organizing committee members volunteers, and all other anonymous contributors who made it happen. Thank you so much for your support. To our donors, sponsors, thank you for your support, and as I mentioned, please continue doing well. We have different institutions here, implementing partner, private sector, UN agency, foreign countries, regional institutions, and bodies. We want to thank you all for your trust, your support. What can I say? You, my brother and sister, those who believe and trust the Tanzania Health Summit, you dedicate your time, 3 days, to be here, to connect, but also to solve problems. I really want to thank you all for your support. Please continue, because Tanzania Health Summit is you, is me, it us. Let's continue to support the Tanzania Health Summit.
Yeah, maybe I should share a little bit my journey with Dr. Jeremy. A little bit of journey. I met Dr. Jeremy in 2015 at his office, Japaigo, and I pitched my idea of Tanzania Summit, and I'm sure he did not understand, but he agreed to give some money. So thank you so much, Dr. Jeremy. You have been so humble and a great man to Tanzania Summit since then, and we really appreciate your time and dedication to our initiative. Thank you so much. Another round of applause to Dr. Jeremy, please. So afterwards, we are going to have a short or few remarks from also a good friend of mine, Dr. Fejo, Gilbert Fejo, who is now a country representative for WHO. Please welcome in front of you.
Thanks, Dr. Shilo. Thanks to the chair of the Tanzania Health Summit. And thanks to all the board members. I recognize your presence, Dr. Grace. Esteemed colleagues, I'm grateful to have this opportunity with the Tanzania Health Summit to speak to you, but mostly to thank the government of Tanzania, the organizers of this summit, and the participants who made the past 3 days a success. Every year the Tanzania Health Summit grows in quality and impact. And I think most of you will agree with me that the 12th edition surpassed all the expectations. I've been attending the summit. I was in Dodoma, in Arusha, in Zanzibar, now in Dar. This is the second time in Dar es Salaam since I'm in Tanzania, I think. And really, really, this was successful. Thank you for all your dedication. Over the course of the summit, we have witnessed a lot of vibrant discussions, from high-level plenaries on data and technology for universal health coverage, specialized forum in reproductive and maternal health, HIV, climate and health, community systems. We saw the youth step forward in the YOCAP workshop and Sotia Vijana Forum, reminding us that the future of the health lies in the hands of our younger colleagues. Although it is a big challenge for them, you know, the health landscape is changing in such a speed that some of you may not catch up with the artificial intelligence. We hear inspiring experience from Zanzibar Jamii Afia program to MMI emergency transport innovations, AI-powered screening tools to youth-driven digital platforms. And as the chair was saying, there were more than 2,000 participants, more than 400 speakers. And this really reaffirmed the leadership in digital health in Africa, not only in Tanzania. Esteemed colleagues, harnessing data and technology is not just about improving efficiency or improving the quality of the reports we are sending to our bosses. It should be about saving lives, using that technology really to protect the lives of Tanzania or to save the lives of people who are already sick. It should be about ensuring that a mother in Kigoma, a child in Twara, or a farmer in Singida can receive quality care, including by telemedicine that the Ministry of Health is promoting, by digital platforms, or just by improved quality, because in the dispensary, in the health center, there will be access to modern tools, to modern equipment, and there will be access to knowledge when our colleagues are delivering the care. And here in Tanzania, we have seen a lot of progresses with the AFIA HMS, the AFIA SS, the unified community systems that are transforming health data and health data capture and use. The digital continuous development platforms that are now reaching 76,000 health providers, thanks to the dedication of the Minister of Health and PURALC. The ELMIS and AI-based forecasting tool that are improving supply chain down to the last mile in our health facilities. But we still have a lot of challenges. Some of these were highlighted in the midterm review that the Minister of Health commissioned last year. Fragmented digital systems with more than 180 digital applications, and some of them are not interoperable. We could be more efficient. Persistent inequity as some of the rural areas and some of the marginalized population are excluded to these digital dividends. Data quality and use gap, especially the use. The data quality is improving, but how are we using data to improve the planning? How are we using those data to improve the quality of services? Sometimes remain a challenge. One of problem that will become greater and greater will be the data protection. How will we protect personal data in the health facilities? Yes, because I said 180 platforms. Some of these platforms are driven by donors, NGOs, and even the platform that is implemented by the government. Are we sure about the cybersecurity? How do we protect the data of our people in Tanzania? Moving forward, how do we address these challenges? Just a few things. The first is governance and policy. We need a strong digital health strategies. And Tanzania have the Tanzania Digital Health Strategy 2025-2030 that was developed by the Minister of Health, which is a model, but must be funded if we want to implement the digital health strategy in the country. The second element is investment in infrastructure and equipment. We need reliable internet, electricity, with, whenever possible, renewable energy. But the government is investing in that, but the government only cannot do everything. I have a colleague from Congo who was always saying that if the government was the one investing in the mobile phone, less than 20% of the population will probably have the mobile phone like it is the case for the health insurance. But when the private sector come in, when the civil society come in, together we will probably go an extra mile. Another issue I have already mentioned is the data security and data governance. It's really important to leverage on the competencies we have in the country to strengthen interoperability of our different platforms, but when we are building the interoperability, also improve the system encryption and the legal protection of the data. And for this, we also need capacity building. Not only capacity building of the young people who are developing all these applications, but also the capacity building of the users. Every health workers, every community health workers should be digitally literate. And we must include some of the element of using the smartphone, using YouTube videos, using TikTok to avoid false information, but also to provide good information to the population, right from the community health workers to the most specialized doctors. Because I can tell you, I'm in the forum where there are doctors. Sometimes you see the videos we are sharing between the doctors generated by AI with fake information, and you ask yourself, we are going to all these conferences, but we don't know how to differentiate between a good information and a bad information. It will become more and more difficult to discriminate what is true and what is not true. And this is really a good challenge. And thanks again for bringing this issue on board during this summit. And two other elements are people-centered design, digital solutions that are affordable and accessible, but that speak to people. That's a digital solution that a patient can use to book the appointment in the dispensary or the district hospital. A digital application that can be used to tell the district hospital that a patient is leaving the health center now and will be in your hospital in 30 minutes so that they can be better prepared, so that our health facility can be more responsive to the needs of the population. I will not insist on the sustainable financing and partnership. I think my colleagues have already highlighted these aspects. But all in all, the future of universal health coverage in Africa can't be done without data, without technology. Yes, it is our story, our individual stories, but let us benefit from this. You know, 20 years ago, when you were reading economic press, they were always saying that the percentage of African with a bank account is less than 4%. Now we all have our mobile money account. We don't even need the bank account. Let us take the opportunity of the AI and move a step forward. That intelligence that made the mobile money system started in East Africa can be used to develop the health system as well. I'm pretty sure. And I've met few guys in Tanzania here who are really brilliant, and sometimes I ask myself, does even our teachers in the universities know that their students are better than them? Let us move from pilot platforms, from fragmentation to integration. But for this, we must not only invest in technology, we must invest in people. in those young people, in building their capacities, in exposing them in international forum, in building the bridge between what they are doing here and what others are doing in other countries. And if we do all this, our data will not just be about the numbers. Our data will guide us towards health equity. Our data will guide us towards improved quality of services. If we get it right, we will transform our health system from reactive to proactive, from fragile to resilient, from inequitable to just. And as we close this summit, I thank again the government. I thank again the organizers. I thank again the partners of the summit, the civil society, the private sector, and most importantly, all the young participants who came and make this summit alive. Together, let us harness digital innovation not as a tool of tomorrow, but as accelerator of the universal health coverage today. Asante sana.
Thank you so much, Dr. Gilbert, for your remarks. The next will be welcoming our chief guest, Dr. Grace Magembe, the Chief Medical Officer from the Ministry of Health. However, before you leave the podium, you'll have to do two tasks: to recognize our abstract judges and reviewers who are on your right side. And then the next one, we will invite Professor Seni, who is the chief judge, to come forward and announce the awards for the best abstract presenters in two different categories, in young but also in adults. And then afterwards, we will close the sessions. Please come forward, Dr. Grace Magembe, for these remarks.
Yeah, let me recognize the presence of our chair, Dr. Halfan Chaku. I must declare I'm also a member of the board for THS, but also board members, our president, Dr. Chilo, with a small p, colleagues and friends, but I also recognize our colleagues from Zanzibar. Yeah, I've seen them, they're here. And to all of you, good evening. I forgot that greeting of ours. I greet all of you in the name of the United Republic of Tanzania. Yeah, how can I forget that? So let me start by thanking all of you for inviting me to officiate the closing ceremony. I know the 3 days have been very hectic, and at least I'm happy I managed to attend 2 days. I couldn't manage the first day, but from the feedback that I got from some of the members, you know, when you're here, you engage officially and unofficially. So I'll tell you what I heard unofficially. Okay, to me that's more important. I think I need to buy what Arnold said. People were telling me that the discussions and the rooms were very hot. I don't know how hot. I was not there to take the temperature, but I'm told the discussions were very vibrant. So congratulations to all of you and congratulations to all of us. I also wish to extend my warm greetings to all the organizing committee, but also to the board members, to the scientific committee who did a great job but also to all the other committees that were really responsible for organizing this 12th Tanzania Health Summit event. I just want you to understand that your presence here actually is a testament of the shared vision and commitment that we have in driving forward the health sector in Tanzania and beyond. So when Arnold was presenting here, he talked about the numbers in terms of the delegates that were able to attend this meeting. And he talked something about 1,700 plus. That's a huge achievement with our club. But also, we are very glad that we had participants, not only from Tanzania, not only local participants, but also from all over the world. Okay, I was very happy to see my sister from the UK. I met her during the UK Health Summit. She's also here attending the Tanzania Health Summit. So you see how big we are growing, okay? So our summit has really grown from a small cat to an elephant. I don't know where we are going now, Jeremy. Growing to what? Amna shida. Yes, so this is a remarkable progress to Tanzania Health Summit. Congratulations, and keep growing and keep making us proud. So as you may all understand, the government has really been in the forefront in terms of supporting Tanzania Health Summit, and this has gone into record over years. It's only this year, I think, we haven't seen some of those very high top officials from the government being here with us from the first day to the last day. I think we are all aware of what is happening now in our country, but I just want to assure you that as a government we are committed, and our commitment is still there. Tanzania Health Summit has been one of the very important partners in terms of driving this sector forward. And so talking of the theme of this year, it says, let me read as it is: harnessing data, utilization, and technologies to accelerate universal health coverage. Data. So, talking of data, without data, there's literally nothing that you can do. And data is no longer a luxury. It is now a necessity. I think we all agree. And that's why there has been a lot of other initiatives to make sure that we get data that is timely, but also data that has the quality that we all want, data that is smart. Because without data, there's literally nothing that we can do. So I think this theme has come very timely, and it's the responsibility of all of us here to make sure that actually we take this theme very seriously, and we see how best each one of us here can implement in their different areas of work. We talk about harnessing data and emerging technologies so that we can improve service delivery, but also enhance accountability and ensure that there's value for money in every investment. I think this is what the WR for WHO was talking about. And I know that data also empowers our decision making. Without data, you have no right to speak. I think that's what scientists will always tell us. You can only speak if you have data. But also, resources are becoming scarce and scarce. We are all aware. I do not need to repeat on that. So how do we make sure that the little resources that we have are used wisely but also efficiently? It's only when we'll be guided by data. It's data which will tell us where to allocate which resource, how much, and when. So the theme is very important, especially this time around when we have a lot of changes happening globally in terms of health financing. Equally important is the role of improvement science, okay, which provide us with practical approaches to transform innovations into actions. And here I want to insist, transform innovations into actions, especially at the community level. Everything starts at the community. I always tell people that, there's no patient, there's no mwananchi, no citizen who belongs to the central government. We all wake up in local governments, in our communities, and we go back to sleep right there. Even where the office you're working, your office is somewhere located in a particular district, in a ward, in a village, or somewhere in the community level, in the local government authority. So our focus should really be at the community, because once the communities are changed, everything else can change. There's no disease which starts up there. There's this famous saying, they say that diseases start in the community and they end where? Yes, you start getting sick there, you go to hospital there, it doesn't matter which level of the facility. And if it happens that you get well, you go back home. And if you die, where do we take you? Back home again. Which home? Jeremy, you have to answer that. I mean, don't be too hard. That's a reality. Yes, back home, okay? So that's all about communities. But also, science will help us to track our progress, whether we are making the right progress or there's something wrong somewhere. We are very proud and always speak about the progress that we have made as a country, one of them being the reduction in maternal mortality from 556 per 100,000 live births to almost 104 now. But how did we get that conclusion? How did we arrive to that? It's science. It did help us to track our progress, after all the interventions that we've been doing as a country. So as a government, we are very excited with this partnership, and I just want to assure that we'll continue supporting the work that has been done by Tanzania Health Summit, but all the stakeholders that are present in here. And I believe there's so much we can learn from each other. The government cannot do it all, okay? We need each other. The role of the government is to put in policies, but also to create a conducive environment for the private sector and all other stakeholders to flourish and to grow. So we are going to maintain that role, okay? But I depend, or the government depends on all of you, technocrats, researchers, healthcare providers, everyone in a different capacities to make sure that we move this agenda forward. But I also want to reassure our development partners. I heard they were mentioned here, UN agencies, but CSOs and other NGOs, that the government of Tanzania is committed to working with you and through you. So please, this is just to reassure you that we are very committed and we are looking forward to continue working together with you. As Arnold said, the presentations, the discussions were very hot. So for those of us who got burnt in a way, if you did not, then you can just continue business as usual. But if you are burnt like me, I think this is enough energy and inspiration for all of us to build on it, but also to build on a new spirit, on how we are going to improve the health sector based on all the lessons that we got from the various discussions. I believe next time when we come here, we'll come with a different story, not the same story. So let all those burning discussions be really a change agent in terms of what we do and how we practice. And all of us here, they have their working place. So I believe if there was a nurse here attending this meeting, when you go back, we expect to see changes in your place of work, in terms of how you think, in terms of how you practice, in terms of how you do things. If you are a doctor, you are a technician, you are whoever, you are a scientist, whoever you are a manager, you are a director, okay? We expect that the sessions that happened here will inspire you to be a change agent wherever you're going. And I just want to appeal to all of you to focus on how we can help the government of Tanzania to strengthen systems of data use and as well as scale digital platforms and foster a culture of continuous quality improvement across the sector, but very specific within the primary health care. Primary health care is the backbone of any health system. There's no way you can have a strong, you can have a resilient health system if you have a weak primary health care system. So I believe as we leave this place, that will be our focus. I just want to remind all of us that every innovation that we've discussed in this meeting must be translated into improved patient experience. You know, all that we are doing here, it's all about the people that we're serving. So if the people will not experience any changes after all these meetings, then they will not understand us. By the way, all of us are here. We requested for permit to come here. We've spent resources, including money, time, and so many other resources. So it will not be good for us to leave this place and the people that are looking at us as change agents, if they will not experience any change from us, if we will not touch their lives, then this meeting will not have a meaning at all. So I believe as we leave this place, you know, the people, the barometer, you know, the people that we serve are the barometer. You cannot say that you are doing well, we are doing what? If they're saying that we are not doing well, then we are failing somewhere, because the people that we serve, they're the barometer of the change that we are preaching every day. And but also we are looking forward for better health outcomes and a stronger health system, especially for the communities across the entire country. So I just want to leave you with two things. One, as we leave this place, I urge all of you to engage actively in improving the quality of care. The quality of care, being it community health services, being it facility, being it whatever you're doing, make sure that there's an improvement from where you are now to another level. But the other thing that I would really want to insist is that it's important for us as the stakeholders, you know, for us as partners, to invest in the health sector across the continuum of care, but also to really focus our energy and efforts at the primary health care, because that's where the people are. For those who are coming from the Ministry of Health, I think we know that almost 80 to 85% of our people, they get their services at the PHC level. So if your 85% is coming from PHC, that's exactly where your investment should be directed. So as we walk out of this meeting, that is one message that I want us to go with. So let me conclude by wishing all of you a very safe journey, for those who are traveling outside Dar es Salaam, but for those who are going outside Tanzania, we wish you a very safe journey as you travel back home. And I hope that we'll continue working together to lift the standards of healthcare in Tanzania, but also across East Africa and Africa. Yesterday, I was very happy to meet some colleagues from the EAC, from the East African community. They were here. I don't know whether they're still here or not. But this is just to show that, you know, we share the same spirit, and what is happening within THS, we want to see it happening across the entire region. And the government of Tanzania, as I said, is very proud to work with you all, and will continue to work with you, you know, today and tomorrow and the days to come. Just for one big reason, to make sure that Tanzania becomes more healthier and more safer. After having said that, I want to thank you, and I want to declare that the 12th Tanzania Health Summit is officially closed. Thank you. I was given 2 tasks. I hope I'll remember them. Now you'll test my memory, both short and long. So one was to recognize the team of reviewers. You do it. Thank you, Chilo, for saving. Oh, so I take it.
Thank you so much, Dr. Grace, for wonderful and great remarks. I would like to invite 2 abstract judges, and they're going to give a brief about how the task was conducted and how did they come into the conclusion of the best abstract presenters. So, number one will be Professor Jeremy Seni. But for a special request, I would like to invite Professor Elizabeth Denley. Maybe a little bit about you, Denley. Professor Elizabeth is a professor on arteriogenesis. I know you have no idea what is arteriogenesis. She is my PhD professor from Germany. And I asked her this year, if she has time to join me. I know she's very busy in Munich, and she agreed to come and see what we are doing here in Tanzania, specifically on hardcore science. Thank you so much, Professor Elizabeth. So, Professor Sen, yes?
And I have to say that I'm so proud of Omari Chilo. The big guy now.
Thank you. Professor Sen, please.
So the Chief Medical Officer, Dr. Grace Magembe, the Tanzania Health Summit Board Chair, President and board members, all distinguished guests, conference participants from within and outside the country, a very good evening. So this year around, we are really grateful that we received hundreds of abstracts, which all had the hardcore scientific merits. And for us, it was indeed difficult to choose which one should really go ahead. So out of hundreds, we were able to review, and at the end of the day, we ended up into having 200 abstracts, which were finally included into the abstract book. So we are a total of 12 judges, and I'm indeed grateful to colleagues who are here. So please, if you could just stand up and wave to the congregation. So we are 6 here. So thank you very much. So because of other competing interests, the other 6 are actually not with us, but we have been working together. So we divided ourselves into 3 groups, so in 3 venues. So each abstract was independently reviewed by 3 judges who at the end of the day gave, we had a special criteria, so each of the judges scored, and then we found an average. And then from that now, we ended up into having 2 bigger group of researchers. So we have what we call the Tanzania Health Summit Junior Investigator Award. And we had the top 2, so a top for among the male group, and then a top investigator award for the female researchers. And then we also have the Tanzania Health Summit Senior Investigator Award. So again, 1 for male and then 1 for female. So those are the 2 awards that we are going to give, and we're going to actually to give award for 4 people. So the judges were also swapping, so we're making sure that we swap from one venue to another to make sure that we are not staying in the room for the 3 days, and we're also swapping across among ourselves, so to make sure that whatever we are producing will be of credible but also of international standard. The team of judges was multidisciplinary team of experts. These are distinguished experts, distinguished researchers, and we actually ensured that they are coming from different backgrounds. So we had experts from hospitals, universities, we had representatives from implementing partners, but also from private and public institutions. So all the sectors were actually equally represented. So after having said that, after now reviewing the total of 200 abstracts, we ended up into selecting the top 10 in each of the 2 groups. So Chief Medical Officer, allow me now to start with the Tanzania Health Summit Junior Investigator Award. So the first one, so the first prize goes to Joshua Patrick Ngembe. So, ladies and gentlemen, Joshua's abstract was on implementing acute stroke services in sub-Saharan Africa, steps, progress, and perspectives from the Tanzania Stroke Project. Thank you. And the same category for the female. So the winner is Lightness Ndashao. So Lightness worked on establishing molecular testing for BRCA1 and 2 germline variants in Tanzanian breast cancer patients, a pilot study bridging genomic and clinical oncology. So, ladies and gentlemen, for the Tanzania Health Summit Senior Investigators Award, so for the women group, so the first one is Dr. Mariam Noran. So Dr. Mariam Noran, abstract was on rare diseases in children, knowledge, practice, and challenges faced by pediatricians in Tanzania. So the title was Rare Diseases in Children, Knowledge, Practices, Challenges Faced by Pediatricians in Tanzania. And then for the male group, the winner is Dr. Mwemezi Ngemera. So Dr. Ngemera, abstract was on understanding the drivers of low contraceptive uptake in Tanzania. So if you have anyone who can come and take on behalf of Dr. Yes, so at least we have a representative, so thank you very much. So, ladies and gentlemen, I think all the 200 abstracts which were presented were ideally supposed to be winners. So all the presenters were winners. We just want now to transform whatever we have presented into policy action. So congratulations to all presenters, and we look forward to see you again next year. So let it be the beginning of next year presentation. All the best, and have a very good evening.
So thank you so much, Professor Jeremy, for the whole process, explaining to us, but as well as announcing our winners for the 2025 Tanzania Summit. But also, I need my role is to ask you, abstract judges, also to be recognized for your great work you have been done for 3 days. I know it's very hard to make all those kind of decisions with regard to a variety of abstracts that were submitted. Your job is very well recognized, and we thank you so much for what you have done. I think the first certificate should go to our Chief Judge, Professor Jeremiah Sen. is Jeremiah. Yes, the second recognition goes to Professor Elizabeth Dendley. Also our third, but also the greatest, Professor Michael Mahande. Thank you, Professor Mahande. The fourth goes to Dr. Magdalena Limo. Our next abstract judge, Dr. George Kiwango. George, I think, is not around. Professor Gerardo Steen. Not around. Not around. Anyway, I should just, I think, mention them if they're not around, but you should hear the names. Dr. Frederick Haraka. We also have Professor Sylvia Kaya from MOAS. Professor Nahaya Salim. Professor Eligius Liamuya. Professor Doreen Kamori. The last but not least, Ms. Masha Makata Yambi. Thank you, Masha, and this marks the end of our Tanzania Health Summit.
But actually, he made sure that people are happy.
Laughing.
Yeah.